As vaccination rates slow down, there is a new variant first discovered in Peru, and it is spreading quickly. Some scientists fear that it may be resistant to the vaccines.
It may not give as much protection to this new variant. That's the concern.
The Lambda variant, or C37, is the latest to cause concern among healthcare professionals.
In studies looking at it in vitro, so not in people, but in plates, it showed higher amounts of virus in the cells that they were looking at. And that's why they think it might be more transmissible, or at least more infective.
Some scientists fear the Lambda variant may be resistant to the vaccines. Dr. Matthew Sims, infectious disease specialist at Beaumont Health, says the vaccine used in Peru is the Covovax, not the Pfizer, Moderna, or Johnson & Johnson like here in the U.S. The WHO says 81% of new infections in Peru is due to the Lambda variant, which some say may also be more deadlier.
When you look at the mortality rate overall in Peru, it's the highest in the world. So it's something like 600 deaths per 100,000. So that's the concern. That's why the thought is it may be deadlier.
The variant is now in 29 nations and has spread to the UK. The CDC says right now there are no cases of the Lambda variant in the US, but that doesn't mean we shouldn't be concerned.
The variant hasn't seemed to spread far outside of South America yet. As compared to the Delta variant, which spread everywhere. We're waiting for those studies, and when those studies come out, we're all going to hear about them, I'm sure.
Healthcare providers still say the best way to stay protected is to get the vaccine. This way, we reduce the chance of more variants from forming.
So the concern is the more spread there is, the more chance of generating new variants. And at some point, one of those variants may really be deadlier.
Dr. Sims says these variants can form anytime and anywhere, and that's why it's important you get the vaccine. For 7 Action News, I'm Alan Campbell.